Deadly nosebleed fever surges in Iraq. Tick-infested cows are being sprayed with pesticide in a bid to contain a deadly fever that causes individuals to bleed to death in Iraq. As the Crimean-Congo haemorrhagic fever spreads from animals to people, the sight of health personnel in full protective gear is becoming more prevalent in rural Iraq. According to the World Health Organization, Iraq has had 111 human cases of CCHF this year, resulting in 19 fatalities. As the virus has no vaccination, it may cause serious bleeding both inside and externally, with the nose being the most affected. According to doctors, it is fatal in up to 2/5 of all instances. As a health officer in Dhi Qar province put it, the number of cases registered is unprecedented. The province, located in southern Iraq, is responsible for approximately half of all cases in the country. On the fingers of one hand were the number of incidents in prior years, he said. In Dhi Qar, the virus is transmitted by ticks, which may infect both wild and domesticated animals such as buffalo, cattle, goats, and sheep. A crew disinfects animals in a barn near to a home where a lady was sick in the hamlet of Al-Bajari. Pesticides being sprayed on a cow and her 2 calves as employees wear masks, goggles and overalls. In a container, a worker exhibits ticks that have fallen off the cow. Since the virus was first discovered in Iraq in 1979, authorities have been astonished by the sudden increase in cases that has occurred this year. Hantouche stated there were just 16 occurrences in his province in 2021 that resulted in 7 fatalities. 43 cases and 8 fatalities have been registered in Dhi Qar this year. In comparison to the COVID-19 epidemic, which has killed more than 25,200 people and infected 2.3 million people in Iraq, the numbers are small, but health experts are concerned. The WHO estimates that the mortality rate of CCHF, which is widespread in Africa, Asia, the Middle East, and the Balkans, ranges from 10 to 40%. Several hypotheses regarding the epidemic in Iraq have been put out by WHO official Ahmed Zoutan in Iraq. During COVID in 2020 and 2021, they considered the possibility of tick spread in the absence of livestock spraying efforts.